reflux, first of all, is very common. It affects 1 in 3 Americans, and it's not just a bad food choice. It's a conglomeration of symptoms that cause significant distress to a certain number of patients. Heartburn, reflux, regurgitation, even having chest pain, difficulty with your teeth, it can be affected. The medical treatment for it has been adequate but not effective in the long term. It really doesn't cure the problem. All you're doing is masking it. And the patients that I see are oftentimes very debilitated to the point that I've had patients say to me that they haven't been able to lie in bed with their spouses for years because of the severe reflux that they're having every time they lie down, despite the use of H2 blockers and proton pump inhibitors. And these patients are looking for relief, and oftentimes they're getting it. And I'm very pleased at how well some of these patients are doing, and in fact the majority of them are doing, with a procedure that is very simple, straightforward, reproducible, and it has shown to have great results.
Oh gosh, I dealt with acid reflux probably about 10 years, I would say. And then I found out about the LINK system and came in and decided to get evaluated. And my acid reflux was so bad, it got to a point, I'd say about 4 or 5 years before I did the LINKs, that food would actually get stuck in my esophagus and it would just sit there. And the only way that I could eat is I would have to, throw up and get all that food out. That's really the only thing that would help me feel better. And then when I found out about the LINKs, I decided to look into that. And since I've got it, I think I had it done in May. I haven't had any issues. Dr. Carcamo had to go in and expand it a little bit because it was a little bit too tight after a few months. But everything's been great. I haven't experienced acid reflux once. What that was like was Dr. Carcamo was very thorough with me. He came in and evaluated me and to make sure they had to go through a process to make sure it is acid reflux and not something else that's going on. So went through that, and it was acid reflux. Once we found all that out, he had mentioned the LINK system and about how that would help me with the acid reflux. So I said, sign me up. And it was honestly one of the greatest things I ever did. It's really good. It's been really helpful.